Hi guys, my name's Jessica. This is my presentation on the elevator speech on the role of the NP. What is a nurse practitioner? Well, we as nurses have kind of an expert knowledge on what a nurse practitioner is. However, I have put some definitions here that came from some articles. Um, One article said, well, the nurse practitioner is a well-recognized subset of nurses who have acquired expert knowledge and advanced clinical skills, which is extremely true because most of us as nurses, um, I'm sorry, for most of us as nurse practitioners, we have all worked as a bedside nurse in any different field, any different specialty, emergency medicine, critical care, med surge. We all have that kind of background to bring with us into our roles as nurse practitioners. Um, and then as we move forward, this was from the textbook. A nurse practitioner or an NP is an RN, registered nurse, who has earned a separate license as an NP through advanced clinical nursing education, usually a master's degree in a distinct specialty area of practice. Nurse practitioners may diagnose, treat, and prescribe for a patient's condition that falls within their specialty area of practice. A nurse practitioner, their education, so they would obviously have a bachelor's degree, and then have moved on to gain their master's, which is what a nurse practitioner needs. Um, so while that's a total of 4 years for your bachelor's, depends on how many years for your graduate degree. Um, could be 2 years, could be four. Um, I also put down here that many similar definitions exist, um, varying state to state, due to the fact that states, there are some differences between states defining whether an APRN is licensed, certified, or authorized. And in the state of Massachusetts, APRNs are authorized, not necessarily licensed or certified. And as we moved on, how does a nurse practitioner differ from a physician's associate? So there are some definitions here on what a physician associate is. A PA is a healthcare provider who practices medicine with physician supervision. Here's a good difference. NPs define themselves as nurses with a broadened scope of practice and do not define themselves as physician supervised professionals. So there is some varying here. Nurse practitioners, while they do need to be supervised by a physician, after 2 years, there is a new policy or new regulation that has been put forth through the Board of Nursing that was present during COVID, that if a nurse practitioner has 2 years of experience supervised under a physician, they then can apply for independent practice, where they would not need to be supervised under a physician. However, PAs do not have that same liberty. They will be continuously connected to a physician throughout their whole time employed. Within the textbook, the differences were legal definition, their scope of practice, their licensure, and their independence of practice, as we have talked about. Physicians associates are trained as autonomous medical healthcare professionals to work alongside doctors, providing access to quality and timely care for a population with ever-increasing healthcare needs. I was reading in one article that physician associates, they are more defined as a collaborative team with a physician. So that is their stance within the medical field, whereas NPs have more of, they are an independent entity, but they can rely on a physician if need be, if they don't have the work experience. Some other areas of differ. would be education. So a physician's assistant does not necessarily have to be a nurse or work in the healthcare field prior to becoming a physician. A physician's assistant, so they have about 2 to 4 years of college. They get their undergraduate degree in a bachelor's, and then a graduate degree is not necessarily required in all states for a physician's assistant. And we are going to move on to, how does a nurse practitioner differ from a physician? So a nurse practitioner differs from a physician largely. A physician is, as we all see as nurses, are the top tier. All of our decision-making aspects go through a physician before we can actually act on our decision or on our thoughts. The physician is the final one who makes the say. However, as a nurse practitioner, you can also gain that independent autonomy after working for so long. So the physician differs in definition, scope of practice, and education. So a physician's education is extremely rigorous. They have multiple steps to their education, such as pre-med school, medical school, and they end up having to go forth through a residency. So all in all, it could be up to anywhere from 10 to 15 years or in between that area. They must obtain an MD or a doctor of osteopathy. Physicians exhibit mastery of medical knowledge, excelled in caring for individual patients, and treated illnesses with an expanding array of cutting-edge tools. Physicians can work in any specialty, depending on what their residency is and what they've chosen during school. And then they focus in on those specialties that they will then work in for the rest of their career. APRNs must have some physician supervision, leading to the ability to work independently. MDs, however, are completely independent, like I said, and work in collaboration with the other aspects of the healthcare team, such as PAs and NPs. And we will move on. Why don't you just become a physician? This is a very good question that I'm sure many of us have asked ourselves. However, becoming a physician is a very large choice. I wrote a few things here on why people don't become physicians. And the first one I wrote was personal choice. Everyone has their own personal pathway that they've chosen. And while some of us I personally myself have wanted to be a doctor, but after thinking through things, the amount of schoolwork and the rigorous studies, I just didn't feel was right for myself. Which is also the next thing, years in school. So many people don't want to be in school for up to 10 years and more. And it's difficult when you're not actually making money during those school years working as a doctor. So yeah, years in school is a big one. Difference in quality of care due to nursing background. So I see a lot of differences between doctors and nurse practitioners. And personally, my opinion, nurse practitioners have a more compatible relationship with their patients. I feel like being a nurse prior to being a nurse practitioner, working at the bedside with your patients, you always kind of tend to form that bond with your patients to try and help them get better by either giving them medications or helping them with whatever they need. That sort of therapeutic relationship is something that nurse practitioners bring to the table, whereas doctors, they do form that same bond, but the compassion and empathy tends to be a little different because doctors are trained to treat whatever's going on with the patient. Sometimes I feel like they don't see the patient as a whole person rather than just the disease itself. Um, so that's also why I think some people choose not to become a physician. And then the last thing that I put here was that some individuals do not want the responsibilities undertaken by a physician. Physicians have a lot of responsibility on their shoulders. Every single decision is theirs to make. Um, every aspect of care given, every medication given, every tool we use to kind of create a better sense of care is implemented by a physician. While we do work as a team, it's the final decision of the doctors on what that plan of care will be, as well as the patients. So why don't you just become a physician? It's a very good question. And one that I don't I I don't think I would make. I enjoy the pathway that I have chosen. And these are my references.